Hello everyone. In this video, we are going to demonstrate how to calculate autopsy rates, gross, net and adjusted hospital. The learning objectives for this video are as follows. Identify alternate terms for autopsy, know where autopsies are performed and by whom, recognize a coroner's case and determine when it would be included in a hospital's autopsy rate. Calculate autopsy rates, gross, net and adjusted hospital. But first, the autopsy definition and interesting fact. An autopsy is the post-mortem examination of the organ and tissues of the body to determine the cause of death or pathological conditions. Another name for it is necropsy or post-mortem after death examination. They can be performed on the entire body or a particular body organ and are usually performed in the hospital morgue by either a hospital pathologist or a physician on the medical staff. A morgue is a place where the bodies of persons who have died are kept until identified and claimed by relatives or released for burial. Interestingly, the autopsy rate has been declining substantially for the last few decades. An autopsy was performed on 40% to 60% of all hospital deaths in the United States before 1970. Now, this rate has gone below 5%. One of the main reasons for this decline are advanced diagnostic modalities. The gross autopsy rate is the ratio of all inpatient autopsies to all inpatient deaths during any given period. Outpatients are not included, and it is customarily reported as a percentage. The gross autopsy rate formula is the number of autopsies in inpatient deaths for a period divided by the number of inpatient deaths for the period. During the month of June, the Harbor Community Hospital discharged 1,035 patients. The hospital reported 300 inpatient deaths, including newborns, and performed 75 autopsies. The gross autopsy rate equals 75 divided by 300, which equals 0.25. Convert the rate to a percentage, 0.25 times 100 to equal 25%. The gross autopsy rate for the month of June is 25%. The net autopsy rate is the ratio of the total number of inpatient autopsies performed by the hospital pathologist for a given time period to the total number of inpatient deaths minus not autopsied coroners or medical examiners cases for the same period. The formula for the net autopsy rate is total autopsies in inpatient deaths for a period divided by the number of inpatient deaths for the period minus cases removed by a coroner or medical examiner. During the month of July, Harbor Community Hospital reported 372 inpatient deaths and performed 124 autopsies. However, 3 had to be removed for forensic study by a medical examiner. Calculate the net autopsy rate, round to 2 decimal places. Net autopsy rate equals 124 divided by 372 minus 3 to equal 0.33604. Converted to a percentage gives 0.33604 multiply 100 to equal 33.60%. The net autopsy rate for the month of July is 33.60%. The adjusted hospital autopsy rate is the proportion of hospital autopsies performed following the death of patients whose bodies are available for autopsy. The formula for the adjusted hospital autopsy rate is the number of hospital autopsies for a period divided by the number of bodies available for autopsy within a period. During the month of August, the Harbor Community Hospital reported 525 discharges, 8 were deaths, 3 autopsies were performed by the hospital pathologist, 1 home healthcare patient and 2 outpatients died and were brought to the hospital for autopsy. Adjusted hospital autopsy rate 3 plus 1 plus 2 divided by 8 plus 1 plus 2 to equal 6 by 11 to equal 0.54545. Convert to a percentage, 0.54545 multiply 100 equals 54.55%. The adjusted hospital autopsy rate for the month of August is 54.55%. And this concludes how to calculate the net, gross, and adjusted hospital autopsy rates. See you next time.